When we talk about cycle, we're talking about what ends the breath. Trigger starts it, cycle ends it. There are different types of cycle mechanisms that we're going to talk about. We could say that cycle is also the length of one breath. It's inspiratory time plus expiratory time, and then the machine cycles off and then ends that breath. I think this slide's pretty self-explanatory. Cycle again ends the breath. It could end because a certain pressure is met. It could end because a certain volume is met, or it could end because a certain flow is met. If you're thinking about the IPPB, it is a pressure cycled ventilator. You guys set a pressure of about 10 or 15 centimeters of water pressure. Once the pressure was at that limit, met that limit that you set, the machine cycled off. The breath ended. So there's something called pressure cycle. When the pressure is met, the breath ends. Volume cycle. When that volume is met, the breath ends. For example, if you set a tidal volume at 350 mLs, once that 350 mLs is met, that breath ends. It's cycled. And then there's a flow cycle. Again, whenever the flow is met, a lot of times we use 60 liters a minute of flow for a patient. Once it reaches that 60 liters a minute, the flow cycles off the breath. When talking about the inspiratory phase, we talk about the beginning of inspiration to the end of inspiration. So that's inspiratory time. How long did it take to get the breath in to the lungs? That's it. That's inspiratory time. Usually it's 0.8 to 1.2 seconds. That's average for an adult. When talking about expiratory phase, we look at the beginning of expiration to the beginning of inspiration. And there's a little bit of a pause in there that you probably don't notice that you do. So we have inspiratory time. That's inspiratory time. And so from that point of maximal inhalation plus that little pause, that is the expiratory time. It's abbreviated capital T and then E. If you take your inspiratory time plus your expiratory time, that gives you the total cycle time. That means how long did it take to get the breath all the way in and how long did it take to get the breath all the way out. That's a total cycle. And if you want to know what their total cycle time is, you would just take their inspiratory time plus expiratory time, and then that is used to figure the respiratory rate. Remember, like I said back in the olden days when Jennifer and I were in school, this is how we figured a respiratory rate. We took their inspiratory time, then we added their expiratory time. That gave us their total cycle time. Then we were able to divide that by 60, and that gave us the respiratory rate. And that's how you have to use to set up a ventilator. Again, now you just turn a knob. Lucky you.